What are the hormones that are usually included with bioidentical hormones? The three main ones are estrogen, progesterone, and testosterone. Most people don't realize, but for estrogen, women produce three different estrogens: estriol, estradiol, and estrone. Of those three, when we do compounding, we typically use the first two, the estriol and the estradiol. We typically don't do estrone because that has shown to possibly increase the risk of cancer. So we just stay away from that one. A lot of times you'll hear the term biased. What does that mean? Biased simply means it's made up of two estrogens. Bi for two, est for estrogen, so two estrogens. Since we're giving the estriol and the estradiol, that's where we come up with biased. A lot of times there will be a number behind it, like 8:2 or 5:5. That typically means there's 8 parts of estriol to 2 parts of estradiol, or 5 parts of estriol and 5 parts estradiol. When we do estrogen, it can typically be done as a cream or as a troche. We do not like to do it as a capsule. When you do it as a capsule and take it orally, you have an increased risk of causing some clotting problems. So we just like to stay away from that. Our preferred way is either doing it in the cream or the troche. Okay, now let's go to progesterone. Progesterone is probably the most important hormone for women. That one we can do as either a cream, a troche, or a capsule. Any three of those routes, all three of them work just fine. Then the last one is testosterone. Testosterone, again, more like the estrogen. Typically only do that in a cream or in a troche. We stay away from the oral because it's just not absorbed very well orally. Many times we can put all three of them together. So all three of them could be in a troche, all three of them could be in a cream. Sometimes that's beneficial. Sometimes we prefer to keep them separate. The advantage is when they're all three together, it is more economical. When you're taking one dose, you are getting 3 hormones at a time. The disadvantage is you can't adjust one without adjusting the others. So if you think you're getting too much progesterone and need to lower it, well, then you're also lowering the estrogen and testosterone at the same time. And so when we first start off, more often than not, we like to probably keep them separate. But then when a person is stable, then we can go on to combine them.
Please don't hesitate to call if you ever have any questions here at the Apothecary.